your PM sessions menu. Your patient monitoring sessions are all stored individually under the patients menu. But you also have a bucket in here called PM sessions, which is your patient monitoring sessions. And in this menu, it stores all your patient monitoring sessions. In here, you'll see the individual patients, their grand total of remote patient monitoring sessions, the grand total for chronic care management sessions, and what is billable for the RPM CPT codes. The intervention reports only show up when a patient monitoring session has been taken. You then will have the option to run an intervention report. As you can see, there's individual patients that don't have any type of intervention or CPT codes assigned because they have not been generated enough for the month of August. You can choose from the drop-down box at any point to look at previous months or previous year. You can expand to view details about those sessions, totaling up the grand total. You can click on any of the CPT codes that is said to find out a little bit about that, why that reimbursement code, a little bit about what that reimbursement code is for. And you can always click the intervention report to run that detailed report to print for the individual patient. You can print it, you can export it. You can see the patient devices that are assigned for that individual user, the total times, the human interaction, which is all based on the notes added from our software, and the individual triggered thresholds that have been triggered by this individual patient, and the date and the value. The interventions, which is the software choosing to either email or send a pre-recorded voice call, SMS, or an inbox message, all through the software, depending on how you set up your expectations. All that is gathered for all the data that's collected for that individual patient. So as you can see, it's now looking at blood pressure systolic. It gives you the details of the low percent, high percent, good percent, total readings found, the blood pressure, interventions. If there was any SMS, it would count them there. All these were email interventions, all by each device type that's been assigned to that individual user. And again, at any time, you can choose a previous month, and the software will go ahead and change and show you the total session times that have been calculated and all the codes that are billable for that individual user. That is a tutorial of the PM Sessions Patient Monitoring Sessions menu.